this is Mr. Stones. We're now about a year out from his shoulder replacement. He's a very athletic guy that was having trouble doing the activities he wanted to do. He was having a tremendous amount of pain with working out and difficulty with doing activities. Tell us a little bit about your shoulder before your surgery.
Oof. Eventually it came to daily pain, limited range of motion. I really couldn't work out much. It was very limited. Just daily pain all through the shoulder.
And so you had your replacement done about a year ago. How much pain did you have after surgery?
I think I ate 3 pain pills completely, totally, and then switched to ibuprofen. The pain post-surgery was limited.
How was the block? Was that helpful?
Yes, I mean, I thought so.
Yeah.
For sure.
It usually does a really good job of limiting discomfort. So we're now at a year out, and he's back to working out and doing activities. Does not have daily pain like he did, right? And let's show off a little bit, show your motion. So he really has, I would say, completely normal motion with full elevation. Come on back down. And then reach around your back, and he can get up really high on his back that way. And then his rotation out this way is just fantastic. So he's done really well, and we're happy that he's progressed in this manner, and we'll hope he doesn't have the same problem with his other shoulder. Here are his x-rays before surgery, and you can see he's got no space between the bone there, and he's got big bone spurs here, and just almost kind of obliteration of the joint space between the ball and the socket. And this is his post-operative x-ray, and we used a stemless implant on him and did a precision shoulder technique for repair of his subscapularis, and that's the socket on that side. It looks really, really good. That's exactly how you want the fit of the ball on both this view and the other view. It looks perfect. So really excited how he's doing. I look forward to discussing the precision shoulder with you and how we can reduce your pain and get you back to the activities that are so important to your quality of life.